Let's talk about health insurance system in Ecuador. Talking about private health insurance. After living in Ecuador for some time, many expats share the same frustration. Why does not my health insurance work the way I expected? The truth is, insurance does work, but it works differently than in countries like US or Canada. And understanding this difference changes everything. Let's start with something important: your broker. A broker like us is here to guide you, to support you, to defend your interest. But we do not control medical pricing, how clinics bill, final decisions made by the insurance companies. In Ecuador, in my opinion, healthcare works as a system of three parts: insurance company, medical provider, and patient. For everything to work properly, those three must be aligned. Now, here is where most confusion happens: ambulatory versus hospitalary coverage. This most important difference you need to understand. Ambulatory care includes some day treatments, minor procedures, or outpatient services. You go in the clinic and you leave the same day. On those cases, even if there is a pre-authorization, it is not a payment warranty. It works more like a reference of how much the doctor will charge you, how much the clinic will charge you. In most cases, you will need to pay upfront and then request a reimbursement with all the paperwork. Also, procedures follow pricing reference of access. What is access? Access is the government office that controls all the reference costs for each procedure in Ecuador. For example, if a procedure has a reference value of $1,700, but the clinic charges you $10,000, the insurance will reimburse based on the reference value from access, unless the higher cost is medically justified from the doctor and from the clinic. This is one of the main reasons why people feel frustrated, because sometimes doctors charge you too much, overprice you, and then the insurance company reimburse you just partial amount of money. Now, let's talk about hospital coverage. This is where the insurance shows its real value. For major procedures or hospitalizations, the process can be properly pre-authorized, and the clinic works directly with the insurance company. Of course, be sure that the clinic is on the insurance network. On those cases, you will only pay your deductible and copays. And to give you an example, in a 35,000 hospitalization with one of our clients, finally she left the clinic paying around $5,000 for the deductible because she had a major medical plan available here on our broker, plus a small amount for no covered expenses, discardable stuff. It was finally around $5,200, and the insurance company paid around $30,800. That's a real power of having the right coverage with the right company and the right broker. Now, what is a pre-existing condition? A lot of people ask, what is a pre-existing condition? What I need to report to the insurance company? And you need to know, a pre-existing condition usually means a previous diagnostic. If you already have a diagnostic, you need to report it. Ongoing medication. Are you using permanent medication? You need to report it. A past surgery. No matter when it was, you need to report it. Or also symptoms before the policy started. I'm feeling pain on my back, my policy will start tomorrow, I need to report it. But here is something very important. Age does not make everything pre-existing condition. Even if you are over 70 years old, new medical conditions can still be covered. What's the most important? They are not related with a previous diagnostic or condition. and there is proper medical documentation. What I am trying to say, if you have clinic records that prove to the insurance company that this is a new condition, the insurance company will pay. This is a technical evaluation, not an assumption based on your age. Now, let's address a very common question. While changing insurance provider fix the problem of no payments or partially paid claims? In most cases, no, because the healthcare system in Ecuador works in very similar way across all the insurance companies in Ecuador. Then, changing providers will not change deductibles, how reimbursement works, or pricing references for medical treatments. However, this is something important to understand. Sometimes it does make sense to change your broker, but keep your insurance policy with the same company. Why? Because if you change the company, the main contract, you may restart waiting periods. Also, has carency periods from zero. What that means? Waiting periods will start again for pre-existing conditions, for ambulatory treatments, for doctor appointments, and for emergencies. And that can affect your coverage significantly. Now, let's be clear about this. Changing your broker should be a strategic decision, not an emotional reaction. You should not change your broker just because you did not fully understand the process or because a claim did not go in the way you expected. Because in many cases, the issue is not the broker. It is a misunderstanding on how the system works. So, when you should consider changing your broker? In my criteria, in my opinion, when you do not receive clear answers, when you do not got your contracts, when there is no technical support, when communication is poor, or when broker lacks experience or reputation. That's when a change can truly add value. Be sure that your broker has experience, that your broker is important on the market, how many years your broker is in the market, how many clients your broker serve. Where you can find that information? On the superintendent website. You will know how much we are selling in insurance, how many clients we have on the market, how much we paid in claims with the insurance companies that we represent. Sometimes, what feels like a bad service is actually a lack of understanding the system. And once you understand how things work, everything starts to make sense. If you ever disagree with a claim decision and you have a technical support to do so, you can escalate your case to superintendent of insurance, and then you will have another opinion about your case. Who will help you to do that? Your insurance broker, with the expertise that your insurance broker may have. Final thought. It is not about whether a claim is a small or large claim. It is not about how much I paid for a claim. When the process is done correctly, insurance does pay. But understanding how the system works is the difference between frustration and peace of mind. We have been in the market for over 14 years, and that is not coincidence. If you feel unsure about your policy or about your recent claim, contact me. I will personally give you a free consultation to review your case and guide you properly. I'm so happy to work with the expat community in Ecuador. We are 14 years on the insurance market, and we are happy to serve you. This is Carlos Ramirez from Blue Box, trying to help the expat community in Ecuador. Take care.